Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'd like to welcome everybody back. Hopefully everyone had a good weekend, got outside, enjoyed a little bit of the good weather, got to exercise a little bit. Again, this morning we're going to be talking a little bit about the current state of the coronavirus and COVID-19 in our community, talking a little bit about preparations in the area, and then also going through some of the things that you've probably heard on media and from our federal government as far as some recommendations, and then obviously taking your questions too today. I'd like to start out a little bit talking about the first thing that was on everybody's mind this morning, which was the release of information that this potentially is going to be the worst week that we encounter. On a federal level, they are using some modeling software to look to see what they think the spread of the virus is going to be, the number of infections, the number of cases that are documented, and then potentially what the outcomes of those cases are. And those models for some of the larger communities, specifically the tertiary care centers in places that are larger cities, New York, Chicago, down in Florida, are showing that the rapid spread of the virus and the illnesses associated with those is going to be greatest in this upcoming week. For those of us that live in communities outside of larger city and urban areas, that's not likely going to be the case. So it's important to keep in mind that we need to temper those recommendations and things that we hear from the federal government and from the large-scale media to what we're dealing with here locally, which is very, very limited numbers of cases and not as severe cases thus far, and very limited spread. So it's important to realize that when you see those types of things on the news, not to be overly anxious or worried about them, because that's not the state of where we are right now in the rest of the country or in rural America. Right now, as of this morning, we've had about 102 cases that have been tested for and have been negative thus far. We've had 9 cases that have been positive in our local community, and every day those numbers change. But just keep in mind that that's a very, very limited number of cases compared with if we look throughout the entire state. The majority of those cases are documented around the larger urban centers, around the cities and where the population hubs of our state are. And the same thing is true around the entire country. So it's important to keep in mind what the situation is around your community versus what you see on the major news media, because it's not necessarily going to mirror those two same things. Those predictive models are telling us that our likely peak is going to be somewhere over the course of the next maybe 6 weeks or so, maybe as late as May. And I will tell you that the important thing to keep in mind with any of those things that you hear on the news, or if you hear us talking about some of the computer modeling and things like that, is there's tons of variables that go along with that. We look at the number of patients that we have locally, we look at how good people are doing with social distancing, and right now in our community people are doing excellent with that. Social distancing has been going very well. We were one of the last states, or one of the last counties within our state that had any positive cases, and so that tells us that you as our community members are doing an excellent job with social distancing and with normal hygiene, which helps keep the spread limited. The course over the next several weeks, every day that comes through, we're getting new information, and we'll have more information as that comes and share that with you, determining how far along we are in that process. But for right now, we are very limited compared with a lot of the larger city centers. Another big topic that was sent to me was talk a little bit about face masks. So there have been all kinds of different recommendations. We've been doing this for about 3 or 4 weeks. And you've heard us talk a bit about personal protective equipment in terms of face masks and eye shielding within the hospital and gloving up and all those types of things. And up until just a few days ago, there was no recommendation out there for wearing anything other than the surgical masks or N95 masks if you were in a high contact area where there would be aerosolized droplets or something to protect yourself from a patient that was infected. Just recently, the government released a recommendation to wear cloth masks whenever you are out in public, including social distancing, but to try to also limit the spread of the virus. It's important to understand that that recommendation comes as they've come on to new data that shows that perhaps people are spreading virus before they become symptomatic. The important thing to keep in mind with that is that whenever you are wearing one of the N95 masks or surgical masks, what we're trying to do is prevent you from inhaling those different types of viral particles and catching the illness. This most recent recommendation is the opposite side, and that is to try to keep people from coughing out and spreading those viral particles when they're out in public. So it's important to realize that a cloth mask or a homemade mask or something like that doesn't carry the same type of protective effect, but what it is doing, it's helping limit people who are coughing that virus out that potentially might not be symptomatic at all yet. So right now, you will see different people applying that rule differently depending upon what area of the country that they're in. So out in the community, you may see more people wearing homemade masks or cloth masks or things like that. It's important to keep in mind that social distancing still applies with that. It doesn't give you the ability to disregard all of that, or hand hygiene or hand washing, those types of things are still very important and need to stay in place. For right now, in our community, we still have a very limited number of cases, and so the people out there that are potentially coughing or spreading that virus are also very limited. So again, not quite as applicable and not quite as important here, but you will see more recommendations of that, especially in large city centers and large urban areas, where they're recommending that people wear face masks that are homemade, regular masks that are cloth, or other types of protection like that to keep them, if they are asymptomatic but spreading the virus, from coughing that out into the atmosphere where it would contact other people. One of the other things that got brought up recently that I was asked about was the concept that people tend to lose their sense of taste and their sense of smell early on in the illness. And that seems to be reported by a lot of patients who contract the virus. It's important to realize, though, that that is not really a great discerning factor as to whether that is the reason for why you've lost your sense of taste and smell. As many people realize that are allergy sufferers like myself, this time of year you'll tend to have a lot more congestion, tend to have a little bit more coughing and a runny nose, and you also tend to lose your sense of taste and your sense of smell. And so it's very difficult to use that as a discerning factor or a diagnostic factor in whether or not you've contracted the virus or not, because that goes along with the common cold, that goes along with any types of nasal congestion, that goes along with any types of allergy problems. So I certainly wouldn't use that as a single factor in saying, oh, I'm concerned that I have this symptom and that may be an indicator that I have contracted the coronavirus. The symptoms that we still want people to watch for primarily are fever. We consider anything above 100.4 as a significant fever. A lot of people ask if they have a 99.4 or 99.5 or 99.6, if that's considered a significant fever. We really consider up in the 100.4 range to be significant. It's important to watch that over time, so we do encourage people to make sure that you have a functioning thermometer at home so you can check your temperature. When we do phone triage and we do virtual visits, one of the things that we like you to do in checking your vitals is to check your temperature, because sometimes you can have a low-grade fever and not really be aware of it. So it's important to sort of track that and make sure that if we are on the phone with you talking about what your symptoms are, that you're able to give us a number based on that as far as what your temperature might be. So just to summarize, fever, cough, congestion, muscle aches, joint aches, feeling sick all over, and there are some indications that some of the digestive symptoms that we talked about before come into play relatively early too, which would be stomach cramps, abdominal pain, diarrhea. We haven't seen too much in terms of people that display vomiting associated with this like they would with a typical viral infection of the bowels like gastroenteritis, but those are the typical symptoms that people see. So I wouldn't necessarily prioritize just loss of sense of taste and smell, but really globally all of those symptoms coming together, that's something that would be more indicative. Everybody's always asking about testing and how testing is going to change over time and what type of tests we're doing and who we're testing. Right now in our community, the most important thing to keep in mind is the primary people that we are testing are people that are sick enough that they need to be admitted to the hospital. They've been sick for a while, they come in to be evaluated, perhaps their oxygen level is low, they're having difficulty breathing, and they need to be admitted for support to get into the hospital, to get oxygen therapy, fluid therapy, those types of things. Those are the primary patients right now in our community that are being tested. And the reason that we're not testing more people is simply because of supplies and very, very limited number of tests available. You will hear about the rapid tests that have come along, and there are communities in our surrounding area that are doing some of the rapid testing, but again, those supplies are very limited. We believe that probably over the course of the next week or so, we will also have the availability of that rapid testing that will be able to be done in our hospital with results as quickly as 45 minutes to an hour after the testing has been performed. Important thing to keep in mind is those testing supplies are going to be limited too, and that testing does not necessarily change anything about how we manage a patient. If somebody comes in and they're doing relatively well at home, and they're eating well, and they're drinking well, and they're breathing okay, and their oxygen levels are okay, generally they're going to be sent home with home care instructions. And the majority of people who contract the virus will be in that category. They don't need hospitalized, they don't need any type of supportive care. It's something that we want to make sure that we try to keep them separated, keep them at home, keep them isolated as best we can, and then with close follow-up. And we've talked a bit in the past episodes about what the close follow-up is about. We know that there are indications that midway through the illness, this can move from an upper respiratory type virus into something that involves the lower respiratory tract when people have increased difficulty with breathing, with coughing, with congestion, and getting more short of breath. If any of that is happening and you happen to be on home care instructions or being observed for potentially having the illness, it's important that you get back in contact with us because we would want to, again, evaluate and see how you're doing with eating and drinking and breathing and check an oxygen level. Treatment, there's been a lot in the news about the different types of emerging treatment, and thankfully there are a number of studies going on right now that hopefully will be concluded within just a few weeks or so that will give us better information on what the treatments are that are available and then how to use those treatments. There are some treatments that are being tested that are used to prevent transmission of the illness in people that are suspected of having it. There are other treatments that are being utilized right now, specifically just on inpatients who are sicker or ventilated. And so the great news for us in the rural areas is that the spread has not been such that we don't have very many cases here yet. And each week that goes by, there's more data that's coming in on testing and on appropriate treatment for those patients. So because our peak is likely going to be later, it's important to realize that we've got more time to prepare. And during that preparation time, all of these other studies are going on, and it's also giving us an opportunity here at the hospital to do more preparation work to increase the potential for our volume here. As Mr. Thacker and I had talked about last week, basically the preparation work here at the hospital has gone to increase our capacity. The first thing was to take our hospital, which normally will accommodate somewhere around 80 to 90 patients, up to a potential surge capacity up to around 250 patients. Along those lines, we've also been increasing our ability to take care of critically ill patients on ventilators and increasing the number of rooms that we have available for that. Most recently, some of the engineers at the hospital have been working on turning more of our rooms into what are called negative pressure rooms, which help to isolate patients who are the sicker patients and also isolate the patients who potentially are going to be spreading more of the virus around. So again, the important measures that you all are taking in the public to limit the spread of the virus is giving all of us more time. And as that spreads out and flattens that curve, that gives us a much better ability to take care of more patients over a better, more reasonable period of time. Tiffany, did you have some questions online?
Okay, there's one question. It says, please forgive me if this has been answered, but if you do get coronavirus or COVID-19, are you immune from getting it again?
That is a great question, and this question will come up a lot over the course of the next several months or so. So, as many of you know, with flu virus, for instance, when you have the flu vaccine, we are hopefully giving you immunity to certain types of designated flu that we assume is going to come around later in the year. Since this is a novel virus, meaning that it's a new virus that none of us have really seen before, although the corona itself type of virus has been around for a long time, this particular one, as we contract this, as we develop our own immunity, we will be immune to this particular type of the coronavirus in the future. What we don't know is how things will progress as far as how that virus mutates over time. And you'll hear a lot of talk about this, and you'll hear even more as we get through this illness and we get into the fall and go into this next winter, as to whether we will all be carrying that immunity around, and if we are not, if there's the potential for us to get a vaccine to prevent it in the future. There are companies that already have sequenced and figured out what that vaccine looks like, and that testing is already going on. Those companies have quoted that they think that probably within the course of the year they will have a vaccine that has been tested, proven to be safe, and potentially ready for distribution. An important thing to keep in mind, though, in terms of the infectious nature of most things, is thankfully over time, as most viruses mutate, they become less severe, less virulent, and we hope that that's the case with this one. Unfortunately, we won't know that until a little bit of time passes. But yes, certainly if you have this illness and you've contracted it and your body's immune system fights it off, you should have immunity to that in the future.
Can you talk a little bit about our supply situation with PPE?
Sure. So across the country and across the world, the supply chain is somewhat strained as far as keeping everybody outfitted in terms of gowns, personal protective equipment, including masks, face masks, gloves, all those types of things. So that's one of the things when we talk about limited testing and trying to evaluate people and keep as many people at home as possible, is it also limits the usage of that material. Because if you're not very ill and you're able to stay home and get through this illness on your own, that equipment that we would have potentially used on you can still be used on your family member when they come back in if they happen to be sicker within a week or within a month. So it's very important to keep in mind that as we are limited on swabs and limited on face masks and limited on gowns and all those types of things, that's one of the driving factors in limiting the amount of testing and limiting what patients get evaluated, because if they are not very ill and they're handling this illness well on their own, we want to keep them away from the sicker population, and that also helps us limit the use of those consumable items. The differences between having a toilet paper shortage, which technically we're not really using any more toilet paper than we would have before the illness, is that all the materials are out there. As it pertains to protective equipment, we are using far more protective equipment throughout this response for the COVID than we would ever use at any other time. So that's why you hear a lot about factories ramping up production of different types of masks, and the car companies chipping in, and the mask companies helping out. And all these things are measures to try to increase the production of those supplies. Right now, we're running anywhere in the range of around 200 or so swabs at any given time. And we try to reserve those for patients that potentially need to be admitted to the hospital, so we can for sure have a positive diagnosis on them. We're also very limited on masks, and that's why people have been encouraged that if they have available masks that they can use at home, that we want to reuse those things if we can. And if you are using a homemade mask at home, it's important to make sure that you clean it. If you are breathing in and out through that mask, you can't just keep putting that mask on every day and expect it to perform the same way. It's important to make sure that you launder that at home. We're also doing something similar here with the N95 masks and some of the other types of surgical masks, is that those are being taken and then sterilized on a regular basis so they can be reused. That way we're not disposing of them after one usage.
A couple of health questions. One person mentions that they have severe rheumatoid arthritis, so are they at high rate to get the virus? And then also those with lupus or diabetes, what should they be doing?
Sure. So it's important to keep in mind that if you have chronic illnesses, that you want to continue to manage those chronic illnesses. It's important that you take your medications as you typically would. I've had a number of patients ask me who have autoimmune diseases and different types of problems if they should just stop their immune suppressive medications, and you definitely should not do that. Those illnesses need to continue to be controlled to make sure that you are otherwise healthy, because if they're out of control and you're not as healthy, you're more likely to contract the virus. Diabetes, high blood pressure, chronic lung disease, immunosuppressive conditions, you mentioned lupus, rheumatoid arthritis, those types of problems ultimately make you higher risk, but by no means do those guarantee that if you're going to get the illness that you're going to get terribly sick with it. Interestingly, some of the medications that we use as immunosuppressive medications are being tested and experimented with in some of those studies that I alluded to. And so there may be some protective effect with that, but there is definitely not enough evidence for us to recommend using those medications outside of their typical treatment usages for autoimmune diseases. Scanning.
Okay, this one actually comes from a reporter.
Okay.
Based on what you are saying about tests being reserved for some of the sickest patients, would it be safe to assume that we have more than 8 cases countywide? Are you monitoring people you think have the virus but haven't tested?
Yes. So the first part of that question, which is, do we think we have more cases than we have positives documented in the county? Absolutely. There's no question of that. There are a number of patients who are self-monitoring at home that likely have this illness, that have not been tested, that ultimately would be positive if we tested everybody. The way that they are being monitored is basically part of the home care instructions are that if you think you have the illness and you're monitoring at home, that you watch your symptoms, and if for any reason you are progressing, then you call us back and let us know. Positive cases are being monitored through the health department. Dr. Stewart is very closely monitoring those. They're in touch with the patients on a daily basis to see how their symptoms are going. They're also talking with family members potentially about developing those symptoms as well. So each of those cases right now are being tracked. It's also important because the health department is looking at that in terms of, is that a community-based person that would have had contact with a lot of individuals? Is that a person that's fairly isolated? Up until this morning, the last report was that the majority of the cases that they had been tracking had come from outside of our community and had a reason for where they had come from. So right now that's being tracked very closely. Now we fully anticipate that over the course of the next few weeks or so, as those number of cases increase, that we're not going to be able to monitor each and every one of those cases and each and every one of the primary points of contact. Lots of us have encountered these patients in the community, and lots of these patients have been encountered in our health facility. and likely there's been very limited spread of the illness as a result of that. But we will continue to watch that over time, and each of those patients will continue to be monitored.
When you talk about the symptoms and, if you are at home sick, a lot of times shortness of breath is talked about. Like, can you explain what they need to be looking for whenever it comes to shortness of breath?
Absolutely. So shortness of breath is something that we frequently ask about. And many people don't necessarily understand what that means. But the first thing that we want to consider is what your baseline is. So if you can go out and you can run a 5K and not get too terribly out of breath, that's your baseline. If your baseline is that when you get up and you walk to the bathroom that you're out of breath and that's your normal, then we always need to keep in mind that that's what the baseline is when we're asking that question. If you can walk out and work in the garden for a period of an hour or so and walk back in and you're not too out of breath, you're not breathing hard or breathing fast, then that's what your baseline is. So what we're really asking when we ask about shortness of breath is what that change from your baseline is. So if you say, I can normally be very active, I normally don't have any problems, but today when I walked out to the mailbox to get the mail, or when I went out and carried the trash to dump the trash, or when I carried my groceries in, I felt more heaviness in my chest, I felt more short of breath, like I couldn't breathe normally, I started coughing more. Those are better indications that tell us that from your baseline something has changed. So it's important to always keep in mind what you would feel normally versus what the potential change is. A normal respiratory rate for a person is somewhere around 12 to 20 times per minute. So if we do a virtual visit with you, one of the things that we observe is to watch you breathing when you're talking to us over the internet or over a video visit. And if we see that you are struggling to breathe because you have to stop to catch your breath before you can speak more words, that's an indication that you're more out of breath. If you give us an indication that normally you could carry groceries in and out of the house, or you could normally walk outside the mailbox and back, and that's not normally the case now, that's an indication that perhaps you're more short of breath.
There's a couple of questions about immunosuppressed individuals. One being, should pregnant women be working in an essential business?
Sure. So for right now, that particular risk group doesn't seem to be as high risk as what we would consider for other illnesses. So in previous years, when the H1N1 virus went around, when we had other more severe types of flu, pregnant individuals have always been considered to be in a higher risk category. When this initially started several weeks ago, the pregnant individuals were considered to be no higher risk than anybody else. That's continually being reevaluated, and so if you are in an essential position, it's still fine to be working if you're pregnant. We would consider all the same important contact precaution measures to make sure that you're limiting your exposure and good hand washing, but as of right now, that's not as high risk category, let's say, as somebody who has chronic lung disease or immunosuppression from cancer therapy or immunosuppression from being treated for rheumatoid arthritis or different types of autoimmune diseases.
Okay, that kind of leads into the next one. About people who are on chemotherapy. Should they continue their treatment or hold off for a while?
Certainly. So the most important thing to consider in that is that this is an important conversation for you and for your oncologist. However, of all the treatment groups that we talk about, perhaps the most immunosuppressed patients that we deal with are the ones that are undergoing chemotherapy. And that is because those types of therapy measures frequently lower the white blood cell counts and the cell counts of the cells in our body that help fight off infection. So before you would ever consider stopping any type of therapy for any type of cancer that you are getting, it's important to have that conversation with your oncologist. For the most part, however, given the fact that we have very limited content of the virus in our community, absolutely I would encourage everybody to continue with their therapy here locally. Now, that may be different in other areas where there's a higher concentration of the virus, but again, if you have yourself social distanced, if you are isolated at home for the most part, and those therapies are currently being given as they are in our facility where we are completely separating off potentially ill patients from the patients that are getting their normal medical treatments, that helps to limit that spread. Most institutions are doing that, but if they have a higher concentration or percentage of patients, it's harder to do. About 3 weeks ago, we separated off all of our suspected patients to be evaluated off to the convenient care clinic, which is out on Willow Street, and that helps to separate nearly all the patients that would be evaluated in our facility off to a separate location. That way we can continue doing all the other types of medical treatment that we normally would in our primary care offices as well as in our hospital facility.
Okay, a couple other questions are related to nursing homes. One, just wondered if you had any thoughts about the nursing home over in Washington and what they're doing over there to use that as a COVID unit.
Sure. So right now, all of that information is relatively new. That's come out over the course of the past few days. You will hear the term cohorting, and cohorting basically to us in medicine just means that we're trying to group patients appropriately. So as if within our normal facility, we keep all of the cardiac patients and the monitor patients in one location. We keep all of the OB patients in one location. We keep all the pediatric patients in one location. We do that for a variety of reasons because the care is specific to those individual groups. We also do that for separation of potential illnesses. So when you hear the term cohorting, a lot of times what we're trying to do is keep the sick patients in one location and the not exposed and not ill patients in another location. What they're trying to do in a facility over in Washington is do just that, is to concentrate the potentially ill patients in one location and separate all the patients that are not suspected of being infected and not having the illness in another location. We are in the process of establishing communication with those facilities that have made those decisions to determine exactly how we can all better work together to make sure that we are taking care of those patients if they need to be cared for in a hospital facility and keep the separated healthy patients away from it. I'm good at biology trivia. You want to do biology trivia?
Okay, I think that those are all the questions that we have right now. There's a lot of thank yous for the weekly updates, so we appreciate that.
I will try to get on and answer as many questions as I can throughout the day today. If you have other questions, please feel free to submit those and I'll get back to you as best that I can. And again, just take home messages, continue with social distancing. As far as wearing your cloth or homemade mask, it's fine to do that, but just make sure that you are laundering that on a regular basis. And please get outside, take your kids outside, take your family members outside, exercise, be healthy, enjoy some of the sunshine, and look at the bright side that being in the place that we are in our rural community really helps us out. So thank you all very much.